My name is Keshri Ficharia. I am from final year of physiotherapy and my topic for rubrics 2 is aeroplane splint and functional arm orthosis. Now first of all, the aeroplane splint. First I will show you the photograph of aeroplane splint. So the aeroplane splint looks like this. Now the definition of the aeroplane splint. An orthosis that position the arm in abduction and external rotation, commonly used to immobilize the shoulder and arm post-injury or surgery. It looks like the wings of an aeroplane. Now, indications. What are the indications of aeroplane splint? So first is brachial plexus injury, axillary burns, post-operative shoulder dislocation, rotator cuff injury recovery, and the last is shoulder capsulitis. So these are the indications of aeroplane splint. Now the third one is design and components. So what is the design of the aeroplane splint and the components of the aeroplane splint? First, the arm supported at 90 degree or 120 degree of abduction, elbow at 90 degree of flexion, and shoulder at external rotation. So the components are rigid or the semi-rigid frames, then shoulder straps, then arm trough and forearm supporting. So these are the design and the components. Now the advantages of the aeroplane splint. So first is prevent internal rotation contractures. Second is maintain proper alignment, and the third one is useful in early nerve injury management. Now the disadvantages and the limitation. What are the disadvantages? The aeroplane splint is bulky and it is very uncomfortable. Second is restrict in activities of the daily living. And the third one is long-term use may causes the muscle atrophy. Now the second one is functional arm orthosis. First I will show you the photograph. So this is how the functional arm orthosis look. This is functional arm orthosis. Okay, now the definition of the functional arm orthosis: an orthosis that supports the partial or the complete arm movement, allowing a complete arm function, allowing the movement, used in case of partial paralysis or weakness. Now the indications of the functional arm orthosis: first is muscular dystrophy, second is spinal cord injury, there is C5, C6 lesion, brachial plexus injury, multiple sclerosis, and post-stroke hemiplegia. Now the types of the functional arm orthosis, there are three types. First is static, second one is dynamic assist to the movement, and the third one is powered. In powered, the electronic support for weak muscles. Now the design and the components. The design and the component of the functional arm orthosis: the shoulder and the shoulder harness and the support, elbow and wrist cuffs, adjustable joints, and there is a band or spring mechanism for assistance. There is elastic band. Now can integrate functional assist for gripping the object. There is a functional assistant for gripping the objects. Now the advantages are aids in performing activities of daily living. Then prevents the contractures, but enhance pattern independence. Then supports therapeutic goals in neurorehabilitation. Now the limitations are required training for use, then custom fitting needed, and may not be suitable for complete paralysis patient. Thank you.